The latest stats showing the UK cancer care lagging 20 years behind most of the rest of Europe, and concerns about burnout being a barrier to NHS productivity growth. We've got NHS providers, health leaders, they say staff burnout, exhaustion and low morale are the biggest challenges facing NHS trust. Well, let's talk about this with John Puntis. He's a co-chair of Keep our NHS Public campaign. He's also a retired consultant paediatrician. Good afternoon to you.
Good afternoon, Julia.
Thanks so much for joining us. I mean, first of all, let's talk about these cancer stats. I mean, look, our cancer care has got better over the years. It's now very slow. People are now dying of cancer who wouldn't have died otherwise because they're waiting so long for their treatment. But extraordinarily, we are still, even on our best day, 20 years behind where the rest of Europe is. Why?
Yeah, it's poor, isn't it? Well, the Commons Health Select Committee under Jeremy Hunt investigated this and reported on it 2 years ago, and the findings were pretty much the same. And of course, the key thing is early diagnosis.
Yeah.
And the barrier to earlier diagnosis was not having enough staff. And in fact, all the cancer targets, they said, were jeopardized by the lack of serious workforce planning in terms of numbers of oncologists, specialist nurses.
Now, we do have an NHS workforce plan now, but we haven't had one for basically the best part of the last 20 years. Whose job was that? Because I find it extraordinary that anyone in charge at any senior level of the NHS doesn't think you need to have a plan for an ageing population, also a fatter population, which means more cancer and heart disease and things, and not planning to have the number of staff that we need. And so they're not going, oh, what a surprise, we've got to import most of the Philippines to come and do those jobs.
Well, it was government and Department of Health responsibility.
Not the NHS.
Well,
not the people we pay six-figure sums to manage the NHS.
Well, governments are responsible for providing NHS services, and part of their job is to do the manpower planning. But, let's be clear about this. Our outcomes are poor because of lack of staffing, lack of long-term planning, and lack of kit comes into it as well, because in terms of the availability of up-to-date diagnostic scanners, for example, we are very, very low.
We have fewer of everything: beds, nurses, doctors, machines, and things compared to other countries with much better outcomes. But we also don't operate a 24/7 healthcare service. We operate a 9 till 5 Monday to Friday service, don't we? Do we not? We also have, borderline third world bureaucracy. Certainly, when I and family members of my family and friends have gone for healthcare treatments, the number of people who don't turn up for appointments, their paperwork's not there, so the operation can't happen. You've got operating theatres, skilled staff whose time is being completely wasted by the fact that actually we've got an organisation that doesn't function very well.
Well, I find it quite extraordinary to hear that we run a 9 to 5 service. I was a neonatal intensive care consultant for many years and would work all day and all night.
No, for things like that and emergency units, absolutely. But for getting a scan, for having an MRI, unless it's an emergency, your routine appointments are 9 to 5, Monday to Friday, aren't they?
Couldn't get a routine scan in the middle of the night, and if I wanted that, then you would have to invest a lot more money again.
But we don't even have them at weekends or early evenings and things like that. Look, that's part of the issue. We've got a lot of world-class equipment and world-class staff who are not being used, not being paid during a lot of that time. What is the solution? Because we've got various different parties vying for our votes right now. Who's got the solution? What is the solution to us? Basically, if you get some cancers, you get some diseases in this country, you're basically more likely to die than if you're living in France or Germany or even, frankly, Romania. So what is the solution?
None of the parties are offering a solution, because the solution involves recognising that we are in an NHS health crisis and that more funding is absolutely critical. And we should be
always more funding. We spend 1.1% of our GDP on our healthcare right now. How much more? How much more? That's quite average for most countries.
We spend 18% less per capita than comparable European countries. 40 billion less a year.
Not now. No, a few years back we did. Not now.
I know that's now. Health Foundation data published in the Financial Times. Look at John Murdoch's graphs, very informative. So we are spending a lot less than comparable countries. And the OECD says actually our outcomes reflect the amount of money that we're putting into the service.
So it's all down to money. Although we've got this report, haven't we, from, as I mentioned, NHS providers saying, staff burnout, exhaustion and low morale are part of the biggest challenge faced by NHS trusts. So getting people, getting people to just work more, be more efficient. And by the way, we haven't seen any productivity or efficiency increases in the NHS in recent years. That's as we haven't across most of the public sector. Do you think that's a big issue?
Well, staff burnout is a big issue, but
why are they burnt out from? Why are they burning out?
Well, partly the after effects of COVID.
Loads of NHS staff didn't work hard during COVID. Loads did, and they did a wonderful and magnificent job, and thank you very much to them. But actually, huge departments were completely empty for months and months on end. I know people who were in those departments working in them.
Well, as you know, a lot of people did work hard during COVID and did took on extra time. So COVID is a factor. The other thing is
3 years ago, they're still burnt out.
Yeah,
but the people who worked on the COVID wards, I can understand for that next year, absolutely. But I mean, it's 2024. How long are they going to still use that as their excuse? They had to work hard while there was a pandemic on. Well, yeah, I'd expect that if I was a healthcare worker.
Is another factor. 120,000 vacancies, so people having to cover other people's work time. And that's another factor. Yeah,
that's certainly big. Can I ask you also, as a retired consultant paediatrician, particularly your thoughts on this? I'm always horrified by these sort of reports, but experts have warned that children face a lifetime of diet-related illnesses unless action is taken to ensure they have access to healthy food. They're saying health issues caused by poor diets are largely preventable, and they're calling for action from the next government. This is the Food Foundation. They say a steady decline in children's health across, they say, multiple metrics, including a rise in obesity, type 2 diabetes, which is largely down to obesity, and then also undernutrition. So kids are being fed, but actually they're getting the wrong kind of food. There's no doubt at all a healthy diet is vital for a healthy body and a healthy mind and healthy growth. But I mean, we talk about access to to good food. This is fundamentally a parenting issue, isn't it?
No, it isn't. It's to do with how much money you have, the environment that you live in.
If you can afford to take, a lot of these kids they're obese. They eat large portions of poor quality food, often takeaway food. If mum and dad can afford takeaways, they can absolutely afford healthy food.
Independent research for the government carried out by London University have shown that poor families often can't afford to buy healthy food, and they're attracted by advertising offers for high sugar, high fat foods, for processed foods. These were supposed to be, advertising for this was supposed to be curtailed. That was part of the 2020 National Food Strategy, and the government delayed implementing those kinds of controls until 2020.
Because poor people are too stupid to be able to work out that chips isn't a healthy meal for their kids. What a load of nonsense.
No, I think people are bombarded with advertising messages.
I'd have a McDonald's every single day if it was up to me and it didn't have an impact on my health.
They're attracted by offers of multi-buys of unhealthy food, which
they buy multi-buys because it saves them money. I mean, which would be a sensible thing to do. We'll have to leave it there.